السلام عليكم. اليوم راح أبدأ محاضرتين. اليوم محاضرة أولى عن الريتنا. الجزء الثاني من الريتنا راح نتكلم عن الريتنا ديتاشمنت اند ماكولار ديس اوردر. الجزء الأول اللي هو الأهم راح نبدأ نتكلم عن the effect of diabetes on the retina and the retinal venous disorder and arterial disorder. نبدأ بالموضوع المهم هو diabetic retinopathy. The reported prevalence of diabetic retinopathy varies substantially between studies, even amongst diabetic population in the same country. يعني the effect of diabetes يختلف من إنسان إلى آخر، من شخص إلى آخر. But is probably up to 40%. It's more common in type 1 diabetic than type 2 diabetes patient. The risk factor لا مهم جدا أن تعرفون risk factor of diabetes. هنا أول patient من يجيني with diabetes أسأله عن duration of diabetes. It is the most important risk factor. In patient diagnosed with diabetic before the age of 30 years, the incidence is increased with time, and after 10 years, the incidence is up to 50%, and after 30 years, it may increase to 90%. فمهم duration of diabetes. Secondly, poor control of diabetes, pregnancy, hypertension, nephropathy, and other risk factors may include hyperlipidemia, smoking, previous cataract surgery, obesity, and anemia. These are the important 6 risk factors for diabetic retinopathy. What are the pathogenesis? Diabetic retinopathy is a disease of small blood vessels. There is a macroangiopathy of small blood vessels due to damage of these blood vessels from hyperglycemia. And at the same time, direct hyperglycemia may affect and cause damage on the retinal cells itself. The classification of diabetes. There is multiple study on diabetic retinopathy, but the most important study is early treatment diabetic retinopathy study. First of all, we have background diabetic retinopathy. In this stage, the patient presented with a normal or near normal visual acuity. There is only on routine examination of the fundus, I can see a macroaneurysm, dot-to-dot hemorrhage, and exudate. Generally, the early sign of diabetic retinopathy, although it may be present with advanced stage of diabetic retinopathy. The most common condition that lead to decrease in the visual acuity, it is the second stage is diabetic maculopathy. It refers to the presence of any retinopathy at the macula, but commonly reserved for significant changes, particularly vision-threatening edema and ischemia. نحن نعرف أنه الماكولا هي responsible for the center of vision. So any disease in this area, hemorrhage or edema, it will affect the vision. The third stage of diabetic retinopathy is a pre-proliferative diabetic retinopathy. At this stage, there is a retinal ischemia. When there is a retinal ischemia, so I can see on the fundus examination there is a cotton wool spot, شكل white discoloration, venous changes, intraretinal macrovascular anomalies (ERMA), and often deep retinal hemorrhage. It indicates a progressive retinal ischemia, and if the condition is not treated, it will lead to progressive to retinal new vascularization. الريتنا بحد ذاتها تحاول تحمي نفسها. there will be progression of abnormal blood vessels حتى تحمي نفسها وتغذي نفسها. these blood vessels are liable for hemorrhage and contraction and lead to traction retinal detachment. at this stage, pre-proliferative diabetic retinopathy, it's a stage of ischemia. If not treated, it will change to the fourth stage, which is the proliferation or proliferative diabetic retinopathy. It's characterized by the formation of abnormal blood vessels, يسموها new vascularization, most commonly present in the posterior pole, يعني حول الأوبتيك نيرف هيد. فيسموها if كانت within one disc on the disc أو إذا كانت within one disc diameter from the disc يسموها NVD. بعدين راح نشرحها. أما إذا كانت away from the disc يسموها new vessels elsewhere. The fifth stage of diabetic retinopathy اللي advanced condition. إذا هاي abnormal blood vessels may bleed, may lead to traction, so there will be a traction retinal detachment, significant persistent vitreous hemorrhage, and neovascular glaucoma. نيجي على التايب اوف هيموريدج. يعني الهيموريدج حسب مكانه، اذا كان الريتينال، اذا كان بالنيرف فايبر لاير الهيموريدج راح ياخذ الشيب، it will take the shape of the layer، فكأنه يبين كأنه flame shape hemorrhage. It arises from the larger superficial precapillary arteriole and because of the architecture of the nerve fiber layer, it will be a flame shaped hemorrhage. The secondly, intraretinal hemorrhage, which arises from the venous end of the capillaries and are located in the compact middle layer of the retina، ويبين كأنه dot blood hemorrhage. أما إذا كان الهemorrhage more deep, it will appear a dark round hemorrhage. It represents a hemorrhagic retinal infarct and are located within the middle retinal layers. تلاحظون هذا ال flame shaped hemorrhage B taking the figure of the shape of the axons layer. In C there will be dot plot hemorrhage, and in the last one D there is dark retinal hemorrhage in the deep layers of the retina. What about the exudate? The exudate most commonly present at the junction of the normal and edematous retina. They are composed of lipoprotein lipid-filled macrophage. It appears as a waxy yellow lesion with relatively distinct margins, may be arranged in clumps على شكل تجمعات أو على شكل ring at the posterior pole. نيجي على diabetic macroedema. Diabetic macroedema سواء كانت foveal edema or exudate or ischemia, it is the most common cause of visual impairment in diabetic retinopathy, particularly type 2. Diffuse retinal edema may be diffuse. The edema may be diffuse due to extensive capillary leakage, or may be localized due to focal leakage from macroaneurysm and dilated capillary segment. هتلاحظون هاي صورة البي، هذا الاوبتيك نيرف هيد، وهاي الماكيولا والفوفيا اللي تلاحظون الاكسيديت القريب عليها. نيجي على Proliferative retinopathy. It has been estimated that over 1/4 of the retina must be non-perfused before proliferative diabetic retinopathy develop. يعني لازم الشبك الريتنا أكثر من ربعه كان صار اسكيميك حتى يبدأ proliferation of abnormal blood vessels. يعني أكثر من ربع الشبكيات تكون اسكيميا حتى تبدأ الحالة. Although pre-retinal new vessels may arise anywhere in the retina, they are most commonly seen at the posterior pole. وفايبرس تشو راح يكون موجود معها، وهذا مع الوقت راح يصير يعمل traction retinal detachment. Initially fine, gradually develop in association as vessels increase in size. New vessels at the disc, it means new vascularization on or within 1 disc diameter from the optic nerve head. If the new vessels away, it describes a new vascularization further away from the disc that may be associated with fibrosis if long standing. If the condition is more severe راح تصل abnormal blood vessels راح يصلون الايرس ويسموه rubeosis iridis, which carry a high risk of progression to neovascular group. بتلاحظون هاي الصورة، هذا mild new vessels on the disc. Second, B and C more severe condition, and D this is fluorescein angiography showing the abnormal tiny blood vessels that's present on the disc. Treatment. First of all, medical consultation. نبعث البيشنت للفيزيشن for controlling good control of blood sugar. نبدأ بالعلاج مالتنا. الأرجون ليزر is important for clinically significant macular edema. Indication: any eye with clinically significant macular edema should be considered for laser photocoagulation irrespective of the level of the visual acuity. يعني هاي الغاية من الليزر اللي هو الأرجون ليزر إنه أي area of leakage نضربه حتى نقلل ال risk of visual loss by 50%. بس عندنا أكو prognostic factors. What are the poor prognostic factors? We have ocular and systemic. The ocular includes significant macular ischemia, exudate on the fovea, أو diffuse macular edema, أو macular edema with severe retinopathy at presentation. هاي poor ocular prognostic factor. Systemic factors: uncontrolled hypertension, diabetic nephropathy, and poor glycemic control. يعني دائما يجيني مريض عنده elevated hemoglobin A1C، هذا يعني انه or poor glycemic control. فتلاحظون الارجون ليزر. البي اللي هي immediately after giving the argon laser to the patient. وتلاحظون بعد الهemorrhage موجود and the exudate present also in B. A, there's a scar which occur after laser after a few weeks. There is no hemorrhage and no exudate. The second line of treatment is intravitreal antivascular endothelial growth factor. نحن حتى نمنع الجروث فاكتور، نمنع الجروينج of these blood vessels، نعطي antivascular growth factor anti اللي هو يسموه راني بيزوماب او كثير بعد نيو جنريشن، بس احنا اللي هو القديم اللي عندنا intravitreal injection of 0.5 ملغ ومور cheaper اللي هو راني بيزوماب initially given monthly for 3 months. نعطي كل شهر المريض يجي نزقه ابره وبعد نعمل reassessment of the patient. The third management line of management is intravitreal triamcinolone, also given in the vitreous. It may decrease the inflammatory condition and it may decrease the edema. Pars plana vitrectomy may be indicated when macroedema is associated with tangential traction, and lipid lowering medication may decrease the requirement for laser treatment, and studies are ongoing. For proliferative diabetic retinopathy, it's important to give a laser for the fundus, for the retina. يعني انه قلنا انه الاريا اوف اسكيميا هي تعمل جروث فاكتور، بيها جروث فاكتور، وهذا جروث فاكتور يعمل نيو فاسكولايزيشن. فاريا اوف اسكيميا اند انفراكشن انا اضربها بليزر، اضربها ليزر ارجون ليزر حتى اعمل بيرن، حتى انهي الستيموليشن اوف فورميشن اوف ذيس ابنورمال بلاد فيزلز اللي مع الوقت راح تعمل بليدنج وتراكشن ريتين اتاشمنت. فابدا بال indication for مثل ما قال indication is aimed at inducing the involution of these new vessels and thereby prevention of visual loss. نبدأ بالأرجون ليزر around the macula. نبدأ multiple shoot تقريبا من 1500 to 2000 burn in a scatter pattern extending from the posterior fundus to cover the peripheral retina in one or more session. يعني نعمل انطي سيشن البيشنت of argon laser، انطيله مثلا 1000 شوت الى 2000 شوت of argon laser. بعد مثلا after 3 weeks اعمل له reassessment if the visual acuity is very good and if there is no abnormal blood vessels اتوقف عند هاي الحالة. اما اذا كانت البيشنت لا كان still there's decreasing the visual acuity, abnormal blood vessels is still present، اكمل another session of argon laser. وتلاحظون الصورة اي appropriate laser burn. لو تلاحظون laser burn هاي immediately، هاي round immediately after giving the patient argon laser. وهذا كملنا session after a few weeks it will appear as scar. نجي على advanced diabetic eye disease is a serious vision threatening complication of diabetic retinopathy that occur in patient in whom treatment has been inadequate or unsuccessful. Sometimes the patient presented with advanced diabetic eye disease at presentation اللي هو hemorrhage. يعني البيشنت راح يجينا عنده hemorrhage first، اما pre-retinal hemorrhage يعني هذا الهemorrhage راح يصير in front of the retina. intraocular يعني نقصد انه in the vitreous داخل ال vitreous cavity او both. Intraocular hemorrhage usually take longer to clear than pre-retinal hemorrhage because the former are usually the result of more extensive bleeding. يعني intraocular hemorrhage more extensive and difficult to be treated. Traction retinal detachment is caused by progressive contraction of fibrovascular membrane over areas of vitreoretinal attachment. يعني تلاحظون حتى على المناطق اللي يصير بها new vascularization راح يصير مع fibrous tissue، وهذا fibrous tissue مع الوقت راح يعمل traction to the retina ويصير detachment. And the last condition is rubeosis iridis. There's abnormal blood vessels on the iris, and if severe may lead to neovascular glaucoma. Rubeosis is particularly common in eyes with severe retinal. وتلاحظون هاي الصورة أي البيشنت عنده pre-retinal hemorrhage لأنه الهيموريدج محصور between the retina and the vitreous، فكناخذ shape of كأنه محصور بطاسة هالشكل، فيسمونه pre-retinal hemorrhage أو subhyaloid hemorrhage. B, there's intravitreous hemorrhage, dark discoloration, multiple diffuse. C, there's attraction around the optic nerve head and the macula. And D, there's abnormal blood vessels on the iris، يسموها rubeosis iridis. فمن وصل لمرحلة المريض انه ما عنده persistent vitreous hemorrhage او عنده traction detachment، هذا indication for surgery. surgery هي بارس بلانا، عن طريق البارس بلانا ندخل عدة نوع من الكتر حتى يقص الفيتريوس ويسحب هذا الهيموريج. فالانديكيشن important if there's severe persistent vitreous hemorrhage. Secondly, progressive tractional retinal detachment. Third, combined traction and rheumatogenic retinal detachment. راح ننطق المحاضرة القادمة عن أنواع الريتينال detachment اللي هو يكون نوعين، اكو tractional واكو rheumatogenic due to the presence of hole in the retina. أو الفورث indication هو premacular subhyaloid hemorrhage. يعني هاي إذا كان جاني مريض عنده vitreous hemorrhage ومثلا ضابطونه ابغى من هاي اللي كنا نضربها اللي هي انتي فاسكولار اندوثيليال جروث فاكتور وما راح الهيموريج، ذاك الوقت احوله مثلا على الفيتركتومي. او اذا كان عنده ريتينال ديتاشمنت، او اذا كان عنده كومباين. لو تلاحظون هاي الصورة، هاي traction retinal detachment involving the macula indication for surgery. large premacular hemorrhage هذا indication for parasplanary vitrectomy. نيجي على الموضوع هذا. انتم تذكروا انه diabetic papillopathy، يعني اكو بعض المرضى يجوني كان صار عندهم optic nerve head swelling مع diffuse abnormal tiny blood vessels. فاحنا هذا احد الديفرنشال diagnosis of، من اللي تلاحظون الوهلة الاولى كانه abnormal new vascularization، لا، هو هذا papillopathy او papillitis which is uncommon variant of anterior ischemic optic neuropathy. It may be bilateral. The etiology, pathology is unclear, but more common in young diabetic patients. The patient usually presented with mild painless visual impairment. On examination, أفرقه عن diabetic retinopathy. There is abnormal optic disc. هون نشعر optic disc swelling، بينما بالdiabetic retinopathy there is no swelling. Secondly, telangiectasia, there is a diffuse tiny blood vessels بكل الاتجاهات، بينما تلاحظون التايني بلاد فيزلز that is present in diabetic أكثر الأوقات باتجاه واحد، مثلا قريبة من ربع الأوبتيك نيرف هيد، فتختلف. The course of diabetic papillopathy without any treatment, just control of blood sugar, there will be resolution of this condition, and within several months with a final visual acuity is 6/12 in more than 80% of the patient. يعني بس نحسن الجود جلايسيميك كنترول راح تحسن المريض، يعني ما يحتاج لا ارجون ولا. هسه راح نتكلم اليوم عن retinal venous occlusive disorder. وتلاحظون هاي الصورة هي في صورة فندس، and in the center is the macula, optic nerve head, and the branches of the central retinal artery and vein. وتلاحظون البرانش retinal vein is wider than the artery. هذا تلاحظون بعدين الصور من تلاحظون it is more wider. نجي على الباثوجينيسيس. Arteriosclerosis is an important causative factor for branch retinal vein occlusion because the retinal arteriole and its corresponding vein share a common adventitious sheath. Thickening of this arteriole, it will compress the vein, and this will cause secondary changes. How? It will cause venous endothelial cell loss, thrombus formation, and potential occlusion. Similarly, the central retinal vein and artery share a common adventitious sheath. At the arteriovenous crossing posterior to the lamina cribrosa, venous occlusion will cause elevation of the venous and capillary pressure with stagnation of blood flow. يعني تلاحظون انه هاي الكومبليكيشن مالته راح تنتهي بالهايبوكسيا، والهايبوكسيا راح تصير اسكيميا، والاسكيميا راح تتولد مثل ما قلنا بالدايبيتيك ريتينوباثي راح تولد abnormal blood vessels. المين pathogenesis هو atherosclerosis, which will cause damage to the endothelial cell loss, endothelial cell of the venule, thrombus formation, and potential occlusion. Regarding the predisposing factor, we have common and uncommon. The common predisposing factor, we have the commonest one is the age, because it is the most important risk factor. Over than 50% of the cases above the age of 65 years. The second most important risk factor is hypertension. It is present in up to 73% of the patient over the age of 50 years and in 25% of the patient that is younger. It is most prevalent in patients with branch retinal vein occlusion. particularly when the site of obstruction is at the arteriovenous crossing. Inadequate control of hypertension may also predispose to the recurrence of this vein occlusion in the same eye or in the fellow eye. We have hyperlipidemia, diabetes mellitus, oral contraceptive pills. We should ask the patient, especially in younger female. They show that in younger female there's a strong association between contraceptive pills and the presence of retinal vein occlusion. Raised intraocular pressure and smoking. There is association between smoking, although the studies have shown inconsistent results. Uncommon risk factor. I think of this uncommon risk factor, especially if the patient under the age of 50 years. We have myeloproliferative disorder like polycythemia, also in smoker patients, abnormal plasma protein, myeloma, acquired and inherited hypercoagulable state like hyperhomocystinemia, inflammatory disorder that is associated with occlusive periphlebitis like Paget syndrome, sarcoidosis and Wegener's pyridomatosis. First of all, any patient presented to me with vein occlusion and hemorrhage in the retina, I send the patient to the physician before I start my treatment, first of all. And the physician, he will check the blood pressure, send the patient for investigation, ESR, complete blood picture, fasting, lipid profile, looking for the important risk factor, urea and electrolyte. Chronic renal failure is a rare cause of retinal vein occlusion, but renal disease also present in hypertensive patients. Thyroid function test, they found that patients with retinal vein occlusion have a high incidence of thyroid disease than the general population. ECG, the physician looking for any sign of left ventricular hypertrophy secondary to hypertension. I will start with branch retinal vein occlusion. The patient presentation with branch retinal vein occlusion depend on the extent of macular circulation. يعني قبل ما أشرح بالاسمه, any patient with normal macula, he will have a normal vision. If the patient have macular circulation affected, it will affect the vision, especially the central vision. So patient with macular involvement often present with sudden onset of blurring of vision and metamorphopsia. What is the meaning of metamorphopsia? Metamorphopsia means distorted image. Or the patient may be presented with relative visual field defects. The patient may be presented with central scotoma or peripheral, depend on the site of that is supplied by the vein. Patient with peripheral occlusion may be asymptomatic. The fundus. I examine the fundus and I will show the signs only to branch, not all the fundus. The posterior pool is there's hemorrhage and flame-shaped hemorrhage and tortuosity. There's dilatation and tortuosity only in the affected venous segment. And the flame-shaped hemorrhage, dotted plot hemorrhage, retinal edema, cotton wool spot, all these are present in the sector of the retina that is supplied by the obstructed vein. The acute features usually resolve within 6 to 12 months. تلاحظون الصورة A, there is a flame shape and blood hemorrhage. تلاحظون B, this is fluorescein angiography, تلوين من الشبكية. تلاحظون this is area of non-perfusion, this side supplied by the branch of the retinal vein. الصورة الأخرى تلاحظون المقطع الأرضي الأخضر، هذا هو عبارة عن مقطع أرضي للشبكية للمركز السنترا للماكيولا، وتلاحظون إنه صار عنده ماكيولار إديما. هاي الفراغات السوداء عبارة عن ماكيولار إديما. Prognosis. At 6 months, about 50% of the eye achieve a vision of 6/12 or better. أرجع أقول the two main vision threatening complication هو chronic macular edema is the most common cause of persistent poor vision after branch retinal vein occlusion. Also, the second one is the presence of neovascularization. Follow-up of the patient should be done after 3 months. If the patient have two things, having a good macular perfusion, better visual acuity, no treatment is required. But if the macula is edematous, I will treat like a patient with diabetic maculopathy. Treatment of macular edema, as I said, laser photocoagulation, intravitreal triamcinolone to decrease the edema, sometimes periocular steroid injection in mild cases, and if the patient not respond, I will treat him with intravitreal anti-vascular endothelial growth factor agent to decrease the edema. Impinging central retinal. Before I will talking about the central retinal vein, some patient may be presented with early sign of central retinal vein occlusion. We call it impending central retinal vein occlusion or partial. It's a relatively poorly defined condition which may resolve if the patient risk factor is disappear or may progress to complete obstruction. The patient is presented with mild blurring of vision which is characteristically worse on awaking. يعني patient يقول أنا من أقعد الصبح النظر ماتي مغوش ومع الوقت يبدأ يتحسن. When I examine the fundus, I see mild venous dilatation and tortuosity with a few wildly scattered flame-shaped hemorrhage. And a patient presented to me with tortuous and dilated blood vessels with no hemorrhage, I should send the patient to the physician to control any risk factor, especially hypertension. So, as treatment is aimed at preventing the progression to complete occlusion by correcting any predisposing systemic conditions and lowering the intraocular pressure. We can give the patient systemic carbonic anhydrase inhibitors to improve perfusion. Anti-platelet agent may be beneficial. وتلاحظوا من هاي الصورة patient with veins tortuous unlike the first picture اللي يجتمع أول صورة وتلاحظوها straight forward بينما dilated وهذا made the uncontrolled hypertension within a few months mostly will have complete obstruction and loss of non-ischemic central retinal vein occlusion. It is the most common type. We have non-ischemic and ischemic. The non-ischemic is the most common type. It accounts for about 75%. The patient usually presented with sudden unilateral blurring of vision and painless. يعني إذا اللي قدامه بالعملي نحن نفرق بين painless and painful. Painless sudden blurring of vision. And on examining the vision of the patient, the visual acuity is impaired from moderate to severe degree. I examine the fundus. I can see there's a tortuous blood vessel, dilated blood vessels. All the branches of the central retinal vein are dilated. يعني بعكس branch only the segment, only one segment. بينما هوني all the branches of the central retinal vein are dilated and tortuous with dot blood hemorrhage all over the quadrant through all the 4 quadrants. Most acute signs only will resolve over 6 to 12 months. Some of the patient may change to ischemic type and the retina will be ischemic if untreated well. About 50% of the cases within 4 months and 35% of the cases within 3 years. وتلاحظون هاي الصورة there's venous tortuosity and dilatation and flame-shaped hemorrhage. Fluorescein angiography show area of non-perfusion. هسا على شكل من الصورة الأخرى بالإسكيميك it's more severe. نجي على الإسكيميك. It's characterized by a rapid onset of venous obstruction resulting in decreased retinal perfusion, capillary closure, and retinal hypoxia. The patient usually presented with sudden and severe visual impairment. يعني يصل المريض مرحلة counting finger or worse hand movement. يعني تعرفون إن من أفحص الفيجن أبدأ بالchart Snellen chart 6 إلى أن يصل 66. If the patient he cannot see 66, I ask the patient to count my finger. So in this patient, the patient have a poor vision, counting finger, or even hand movement. When I examine the pupil reaction to light, there is a relative afferent pupillary defect. On examining the fundus, there is severe tortuosity and engorgement of all branches of the central retinal vein, extensive deep blood and flame-shaped hemorrhage involving the peripheral retina and the posterior pole, severe disc edema and hypertonia. هسه إذا الصورة وتلاحظون all the branches with severe dot blood hemorrhage and flame-shaped hemorrhage وتلاحظون severe capillary non-perfusion مقارنة بالصورة السابقة of non-ischemic. The prognosis is extremely poor due to macular ischemia, and if the ischemia continue مثل ما حكينا بالdiabetic retinopathy تتحول إلى new vascularization and it may reach the iris, causing rubeosis iridis in about 50% of the cases. And this is usually within 2 to 4 months, will cause 100-day glaucoma. Treatment of neovascularization. احنا الاريا اوف اسكيميا انا بقدر ارجعها، فحتى لا تبقى تعمل stimulation for the progression of abnormal blood vessels انا اوقفها، اعمل ليزر بيرن، فيسمونه aggressive laser pan-retinal photocoagulation. Should be performed without delay in eyes with angle neovascularization or rubeosis iridis. I will apply about 1,500 to 3,000 burns in the first session. Now I will talk about the retinal artery occlusion. انتم عرفتم انه venous occlusion اكو branch vein occlusion, only one segment will be affected, while the central retinal vein, the whole segment, the whole quadrant is affected. If the vision of the patient with branch retinal vein occlusion depend on the area that's supplied by the vein. If it affect the macula, the vision will be affected. While in central retinal vein occlusion, so an ischemic and then ischemic, the central vision is affected, and the patient require urgent treatment and management. Regarding the retinal arterial occlusive disorder, atherosclerosis related to thrombus at the level of the lamina cribrosa is by far the most common underlying cause of central retinal artery occlusion. The incidence of atherosclerosis increases with the age. تقريبا نفس الريسك فاكتور. Age, hypertension, hyperlipidemia, diabetes, oral contraceptive, the same risk factor. Hyperhomocystinemia, other risk factor like obesity, tobacco smoking, and lifestyle patients. Also, the systemic assessment, the same as in branch vein or in retinal vein occlusion. Many patients will have a history of vascular disorder. Also, we ask about smoking, ask the patient about any headache, jaw claudication, scalp tenderness, looking for sign of giant cell arteritis. The pulse should be detected for looking for any atrial fibrillation. The physician will check also the blood pressure, the cardiac auscultation. نجي على مصطلح يسمونه amaurosis fugax. Amaurosis fugax is characterized by painless, transient monocular loss of vision, often described as a curtain. يعني المريض يوصف لي إنه كأنه غمامة أو سواد coming down over the eye, and it will last for a few minutes. يعني المريض يقول لي أنا مثلا مرات تجيني several times per day، أو مثلا مرة بالشهر يصير عندي مثلا على لمدة دقائق كأنه النظر ينزل غمامة سوداء تنزل مثل كورتين أمامي. Last for a few minutes. It may be idiopathic or due to embolus. This patient also should be sent to the physician, checking for any ipsilateral attack of cerebral TIA. In patient with branch retinal vein occlusion, the patient also present with sudden and profound painless altitudinal or sectoral visual field, according to the area that's supplied by the branch artery. It can sometimes go unnoticed, particularly if the central vision is spared. The vision is variable, depending on the area of disease. Relative afferent pupillary defect is often present. Fundus, there is narrowing and attenuation of the arteries and vein، لأنه هو branch artery will cause whole artery instead. Both the drained vein and the artery are narrowed with the sludging and segmentation of the blood column. So the retina will be cloudy, wide edematous, ground glass appearance, corresponding to the area of ischemia. وتلاحظون الصورة اللي inferiorly هاي لها white retina كصارت white and edematous with segmentation of the artery. This is a branch retinal artery occlusion. Prognosis. In patient with central vision is severely compromised, the prognosis is commonly poor unless the obstruction is relieved within a few hours. Regarding the central retinal artery, the patient presented with sudden and profound loss of vision, painless except in giant cell arteritis. The vision is severely reduced. يعني حكينا احنا الفيجن بالبرانش فين اوكلوجن راح يتأثر حسب المكان. central retinal vein occlusion, the patient may be presented with counting finger. بينما patient with central retinal artery occlusion there's severe reduced in the visual acuity، يعني يصير مرحلة light perception فقط، وإذا ما تعالج خلال يومين أو 3 أيام حتى light perception يفقده لأنه كسر infarction. Relative afferent pupillary defect is profound, sometimes total، يسمونه amaurotic pupil. The orange reflex from the intact choroid stand out at the thin fovea. يعني احنا هاي المنطقة كلها not supplied by blood, so the retina appear, the whole retina appear white edematous. فقط الفوفيا center of the macula اللي هي الفوفيا لأنه thin، فالunderlying ground reflex من الكورويد راح يبين، فينطيها picture يسموها cherry red spot، والإشعة طبعا ما ينزل. وتلاحظون كل الريتنا الفندس كله أبيض مقارنة، أبيض بيل مقارنة بالصورة أول صورة النورمال، وبالنص مكان الفوفيا اللي اورنج ريفلكس من الكورويد. The prognosis of central retinal artery is poor due to retinal infarction. Treatment of this condition is an emergency. Why? Because it will cause irreversible visual loss due to retinal infarction unless it is established prior to the development of this infarction. يعني هي تختلف عن central vein occlusion. Central vein occlusion I can send the patient to the physician at the same day or after a few days. I can give him later on within a few days laser antivascular endothelial growth factor injection, while in patient with central retinal artery occlusion the occlusion should be reversed within 24 to 48 hours, so the patient should be admitted to the hospital. Adoption of superimposition, it may improve the ocular superfusion. Ocular massage, I can do the massage by my thumb, I will do pressure on the eyeball. This may cause movement of the emboli. If I for a few seconds I then remove the pressure, then I can continue doing this for a few minutes. Third, I will give the patient topical timolol. It will decrease the intraocular pressure. Intravenous acetazolamide 500 mg. It will achieve a more sustained lowering of the intraocular pressure. Sublingual isosorbate dinitrate to reduce the vasodilatation and breathing a higher oxygen content. المحاضرة خلصت اللي هي Diabetic Retinopathy, Retinal Vein Occlusion and Retinal Artery Occlusion. المحاضرة القادمة راح نكمل إن شاء الله من ضمن Hypertensive Retinopathy, Retinal Detachment and Macular Disorder. إذا عندكم استفسار أنا موجود. المحاضرة راح تنزل على الموديل. شكرا.